Tirzepatide is a medication sold under the brand name Mounjaro and recently approved by the US FDA to treat type 2 diabetes, but it also seems to be effective in helping adults without diabetes lose weight. Tirzepatide is an analog of the glucose-dependent insulinotropic peptide, or GIP, which is a human hormone that stimulates the release of insulin from the pancreas. Tirzepatide is a linear polypeptide of 39 amino acids, and it's been chemically modified by lipidation to improve its uptake into cells and to stabilize its metabolism. So if you were to eat this drug, it would literally be broken down into its components of amino acids and rendered useless. So that's why this medication has to be injected subcutaneously, so that way it doesn't get broken down by the acid in your stomach and by the enzymes in your GI tract. Therefore, it ends up being bypassed after the liver, and it gets absorbed into your bloodstream after it's injected subcutaneously. The interesting thing about the way that this drug works is that it has a high affinity to GIP receptors as well as GLP-1 receptors, glucagon-like peptide 1 receptors. And this dual agonist behavior has been shown to produce greater reductions of hyperglycemia compared to those selective GLP-1 receptor agonists. Overall, it increases insulin secretion in addition to increasing levels of adiponectin, which is an adipokine involved in the regulation of both glucose and lipid metabolism. So when adiponectin is increased, it literally tells the cells to burn those fat stores. Tirzepatide also slows the passage of food through the gut, which can help people feel full and feel satisfied more so after eating. This can make it easier to stick to a calorie-controlled diet and to avoid the temptation of snacking in between meals. It basically suppresses appetite. So it's two main reasons why people lose weight with this drug. Suppresses appetite, and because of the adiponectin literally burning those triglycerides in those fat cells. The main tirzepatide study was published in the New England Journal of Medicine. It involved over 2,500 participants who had a BMI above 30 or a BMI above 27 with at least one weight health-related condition. But the study specifically excluded those with type 2 diabetes. All participants received weekly injections of tirzepatide or a placebo, and they participated in counseling sessions to help them maintain a healthy diet and exercise. So they're regularly eating healthy and exercising in addition to either placebo or this drug. Now, the medication was tested in dosages of 5, 10, and 15 milligrams. So basically what they did was they broke the groups into four. One was the 5 milligram, the other was the 10 milligram, the third was the 15 milligram, and the fourth was the placebo group. Now, those who were on the 5 milligram dose, they lost an average of 35 pounds. Those on the 10 milligram dose lost an average of 49 pounds, and those on the 15 milligram dose lost an average of 52 pounds. The results of this study were obviously impressive, with 40% of the participants losing a quarter of their body weight. The weight loss seen in the study was even greater than that observed in previous studies of people who had diabetes who lost an average of 15% of their starting body weight when using this drug, tirzepatide. The impact of the medication on people with diabetes is still considered significant, providing more weight loss than other available options. Benefits with this drug included more than just weight loss though. They had a decreased waist circumference. It also lowered blood pressure, and it lowered fasting insulin levels, and it also lowered cholesterol levels. 95% of those with pre-diabetes at baseline had reverted to normal blood glucose levels as compared to 62% in the placebo group. Now overall, 80% of the participants treated with tirzepatide did report at least one adverse event that emerged during the treatment period as compared to 72% of the participants in the placebo group. What is the most common side effect? Well, it was either nausea, diarrhea, or constipation, and between 2.6 to 7.1% of the participants had to discontinue treatment due to those side effects. Still pretty rare though. Tirzepatide, it does carry a boxed warning about the risk of developing thyroid tumors, and therefore it should not be used by people with a family history of certain thyroid conditions. In addition to hypoglycemia, meaning low blood sugar levels, there's also a slight risk of pancreatitis, meaning inflammation of the pancreas. In this study, there were 4 reported cases of pancreatitis that was evenly distributed across the treatment groups, including the placebo group, none of which were severe cases of pancreatitis. There weren't any cases of medullary thyroid cancer reported, at least from this short-term study. Overall, the results of this study suggest that tirzepatide may be a very valuable option for adults who are struggling with obesity or being overweight, as it resulted in weight loss far beyond what is typically achieved through lifestyle changes alone. It's not to say that you can't get these results without lifestyle changes alone, it's just that on average, this was better compared to that alone. The magnitude of the weight loss seen in the study was comparable to what's typically achieved through weight loss surgery, and the self-injected weekly dose may be a more accessible option for most people. Now, it's important to note that the medication should be used in conjunction with a healthy diet and regular exercise to achieve the best results. Earlier in this video, I mentioned two things that are actually very easy to overlook. One is that this study excluded patients with type 2 diabetes. The second thing is that tirzepatide lowered the study participants' insulin levels. Everyone thinks that you become metabolically ill as a result of gaining weight. But the reality is 80% of the time, it's actually the opposite. First, you become metabolically ill and then you gain the weight. In fact, 20% of obese people are in fact metabolically healthy. So if you randomly put 100 obese people in a room, 20 of them will in fact be metabolically healthy. And the medical term for this is MHO, metabolically healthy obesity. And because they're metabolically healthy, generally speaking, they have normal lifespans with normal length telomeres. These people have lots of subcutaneous fat, but very little ectopic fat, meaning fat in cells that shouldn't have fat, for example, liver cells. They also have normal metabolic function and low insulin levels. Now, maybe you're wondering, what is metabolically healthy and what is metabolically unhealthy? Metabolically unhealthy is metabolic syndrome, meaning the inappropriate storage of energy in the wrong form in cells that shouldn't be storing it. There's only 3 types of cells in the body that should be storing energy. That's going to be fat tissue, so that's where you have fat cells called adipocytes, which store excess energy in the form of fat. 2 is muscle tissue, and 3 is liver tissue, and they're supposed to store excess energy in the form of glycogen, which is the storage form of glucose. Fat that is stored anywhere outside of fat cells is called ectopic fat. So if the muscle or liver, or even sometimes the pancreas, end up storing ectopic fat, guess what happens? Those tissues start to develop metabolic dysfunction, and they start to function abnormally. What about the 80% of overweight people and obese people who are metabolically unhealthy? They didn't gain the weight and then become sick. They became metabolically ill as a result of developing high insulin levels and insulin resistance, and that is what caused the weight gain. But since their fat cells still responded to the insulin, despite most of the cells in the body being resistant to insulin, well, that means that the extra insulin told those fat cells to store more energy. So those fat cells got bigger and bigger and bigger. And what if you're not overweight or obese? If you're thin, that must mean that you're metabolically healthy, right? Not necessarily, because the thin people can be thin on the outside, fat on the inside. In fact, 40% of people who are normal weight are in fact TOFI, which is to say they have some degree of metabolic dysfunction, insulin resistance, and high insulin levels. But for whatever reason, they're just not obese. And some of them, their fat cells are in fact insulin resistant. So energy isn't really stored excessively in the subcutaneous tissue. So where does it go? It ends up getting stored as ectopic fat in organs that shouldn't be storing that fat, like the liver, like the muscle, and sometimes the pancreas. So what you really want to pay attention to is the degree of ectopic fat in the body, which of course is the fat that you can't see. It's the ectopic fat that determines if someone develops diabetes or heart disease. So the people in this study with tirzepatide, who were all overweight or obese and none of them had type 2 diabetes, it's likely that most of them, if not all of them, were MHO, metabolically healthy obesity. So the bottom line is you can't always tell if someone is metabolically healthy or not by simply looking at them, because if they're thin, they may or may not have TOFI, and if they're obese, they may or may not be MHO. Regardless, this study showed that tirzepatide undoubtedly causes weight loss as it acts as a GIP and a GLP-1 agonist, thus suppressing appetite and burning fat. But simply taking this drug without doing the other healthy lifestyle habits like exercise and eating healthy and so forth, that's only going to get you so far. Not to mention intermittent fasting, which based on this study, not only causes weight loss, but actually reverses type 2 diabetes. And you can check out that video for more details right here.